Robotic radical prostatectomy procedure. Robotic radical prostatectomy has several advantages over other treatments for prostate cancer. Because the prostate is actually removed, the tissue can be extensively studied under the microscope, and the true extent and aggressive nature of cancer can be determined. Compared to open surgery, robotic prostatectomy patients experience less blood loss, less pain, and have a quicker recovery. Robotic radical prostatectomy allows surgeons to operate through small incisions using highly advanced clinical technology. The three-dimensional camera system magnifies tissue up to 15 times, allowing the surgeon to identify key blood vessels, nerves, and prostate anatomy. The surgery typically takes 2 to 3 hours and usually requires a 1 to 2 night stay in the hospital. During the surgery, a catheter is placed into the bladder to allow proper drainage and healing. Risks and complications. The goal of the robotic radical prostatectomy is to cure your cancer and to ensure normal quality of life. The potential risks and complications of this surgery are bleeding, infection, incontinence. 5 to 8% of patients will experience persistent incontinence. Most patients will experience temporary incontinence, and those who have persistent incontinence, there is effective treatment available. Impotence, also known as erectile dysfunction, or ED. The nerves that control erections are located very close to the prostate gland. Depending upon the stage and the aggressiveness of your cancer, the doctor may or may not be able to spare these nerves. Even with perfect nerve-sparing surgery, most men will experience a period of time where they cannot have an erection. Sexual function after surgery depends upon the patient's age, their function prior to surgery, and other health issues. Blood clots in the legs, also known as deep vein thrombosis or DVT, occurs in 1 to 2% of patients. Risk of lymphatic fluid leakage, also known as a lymphocele. Injury to the obturator nerve causing leg pain and decreased leg movement. Risk of having to convert from robotic to an open approach. And finally, bowel or rectal injury. Prepping for the surgery. Before surgery, you will be asked to stop eating or drinking anything besides a clear liquid diet for 24 hours. You should abstain from eating or drinking anything after midnight prior to your surgery. You may take your medications, except for blood thinners, with a small sip of water the morning of the procedure. A detailed patient instruction sheet will be given to you prior to the surgery date. What to expect after surgery? After surgery, you will be asked to walk as soon as possible to prevent blood clots from forming in your legs. Most patients do not have a bowel movement while in the hospital, but you must pass gas to ensure that bowel function has returned. If you can walk, eat, and there is no significant fever, you will be discharged home. During recovery, you should be able to resume most of your normal activities. However, you should not drive or lift anything more than 30 pounds. The patient may experience constipation for a few days after surgery. Stool softeners are often recommended. We ask that you drink 5 to 6 glasses of water a day and maintain a high-fiber diet. Some blood in the urine is expected, but there are several things you should monitor and let your doctor know right away if they appear. If you start passing clots in the urine, if the urine starts flowing back through the catheter or if it does not empty into the catheter bag, if you have progressive swelling on your ankle or entire leg, and if you have a fever higher than 101.5 degrees Fahrenheit that cannot be controlled with Tylenol. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.